Good evening, everyone. It's been a long day for all of us. We started with the afternoon and happy to see the audience still there with the evening. Wish you all a good evening. We have moderator today, Radha, who will be moderating the session, the last session today on Mind the Mind. Radha leads the technical support unit for non-communicable diseases for Maharashtra. She is a medical doctor with specialization in community medicine. Radha has played a key role in conceptualizing Government of Maharashtra's Man Swasthya campaign for mental health during COVID-19. She has received many awards for her research work on adolescent, and she also has authorship for IIPSM Community Medicine textbook. Over to you, Radha, and request you to introduce our speaker today, Dr. Soumitra Pathare. Thanks.
Thanks for the kind introduction, Sudeshna. Hello and a very good evening to everyone here. My name is Dr. Radha Valalikar, and I work for Piramal Swasthya, an organization that works towards making healthcare accessible, affordable, and available to all segments of the population, especially those most vulnerable. The fact that you have made it to this Charcha 2021 session titled Mind the Mind probably suggests two things. One, you either recognize that mental health is an important issue and agree that it needs to be discussed, or two, you wonder if mental health is even an issue and have come here to find out why this is even a session at Charcha 2021. Either ways, I promise you'd be going home with some really interesting insights. I would like to open this session with few lines from a poem titled Nothing to Show by Helen. The hardest thing about my illness that I have long endured are the warped accusations that somehow I'm choosing not to be cured. That there's a way I can just outthink it and send it on its way. But to someone with a tumor, that's something you'd never say. So although my disease is hidden deep inside my mind, please do your best to understand and above all, be kind. Take a moment, have a think. How do you think you would feel to be crippled by a devastating disease while some question if it's real? So my plea is a simple one. It's all I ask of you. Treat a person with depression how you'd like to be treated too. Friends, the central theme of this fireside conversation is stigma. Stigma against mental illness, people with lived experience of mental illness, towards seeking care, making changes in provisions, policy, and more. Although this is a virtual fireside conversation and there's no real fire beside us, we certainly hope to create a spark and ignite the minds that have gathered here today. Joining me in this fireside chat is Dr. Soumitra Pathare. It is my pleasure and honor to introduce him. Dr. Soumitra Pathare is a consultant psychiatrist and the director of the Center for Mental Health Law and Policy at the Indian Law Society, Pune. Dr. Pathare's primary interests are in the areas of mental health policy, scaling up mental health services, rights-based care, and legislation. He has provided technical assistance to the Ministry of Health and Family Welfare, Government of India, in drafting India's new Mental Health Care Act 2017. He was also a member of the Mental Health Policy Group appointed by Government of India to draft India's first National Mental Health Policy released in October 2014. He has served as a WHO consultant in many low and middle income countries, assisting them in drafting and implementing mental health legislation and national mental health policies. Above all, Dr. Pathare is also a guide and mentor to many young minds. Welcome, Dr. Pathare.
Thank you, Radha. Thank you for the invitation. Thanks to Piramal Swasthya and Charcha for the invitation, and thanks for that kind introduction.
Thank you. So before we start this discussion, I would like to request for the first poll to be posted. Do we have the first poll question? Yes. So the question reads, have you ever taken a day off from your work or college due to low mood, citing some other reason? So for the benefit of the audience, I may just point that this question is in the poll section on AirMeet. Please cast your vote, and we are going to discuss this shortly. Thank you. In the meanwhile, um, Dr. Pathare, I feel at this moment we are living two pandemics. One is, of course, COVID 19. The second being a pandemic of collective loss and grief. The COVID 19 pandemic has brought to light several issues of importance, mental health being one of them. Do you feel, as a consequence of this, the stigma towards mental health is actually decreasing?
Okay. I mean, I'm going to try and answer that slightly in a way which I like to answer that question, which is, we always tend to refer to stigma and discrimination as as a term. You'll hear people say stigma and discrimination, and I think what happens is that we should really focus on discrimination rather than stigma. And there are reasons why I say that, because discrimination is measurable, stigma is an attitude. And while discrimination might be the outcome of stigma, very often stigma is the outcome of discrimination. So if you want to understand what I mean, is that even during the COVID crisis, you must have noticed that it took a lot of effort before people with severe mental illness, for example, were prioritized for vaccination. Okay, this is despite the fact that there is a lot of research from many countries in the world which shows that after age, the second highest risk factor for death after COVID is schizophrenia. So age followed by schizophrenia are the number one and number two risk factors for death after COVID. And despite that, not only in our country, but in many countries, people with severe mental illness were not prioritized for vaccination, while people with diabetes, people with hypertension were all prioritized for vaccination, or cancers were prioritized for vaccination. And that to me is not just stigma, that is discrimination. And the fact is that discrimination actually affects people's lives. It results, in this case, it could result in death for people with severe mental illness because they've not been prioritized for vaccination. And why focus on discrimination? You'd say, what's wrong in focusing on stigma? The reason to focus on discrimination is because discrimination is measurable. It's behavioral, it's measurable. And so you can actually measure and see whether you've reduced discrimination. You can actually have policy provisions to reduce discrimination, while stigma does not work that way. So I think what we need to do is really focus on discrimination. And there's another important reason why focusing on discrimination helps stigma. There's been a lot of research on stigma in the last 2, 3, 4 decades. And the one consistent finding from mental health stigma research is that the only thing that reduces stigma is contact with people with mental health problems. Now, if contact is the main way to reduce stigma, how do you get contact? If you have discriminatory policies, if you have discriminatory laws, if you have a general discrimination which results in exclusion, you're not going to come across anybody with a mental health problem. You're not going to see them around. So if you want to have more contact and reduce stigma, then discrimination is the route to reducing stigma. So rather than thinking of it as a flow from stigma leading to discrimination, I think we should say that discrimination, if we eliminate discrimination, it will reduce stigma too. And eliminating discrimination is something that we need to do any which way if we want to have a more just and fair society where everyone is included. So I think discrimination is what we should be focusing on as a society, as the mental health community, as all the stakeholders in the mental health system.
Okay, that was a really interesting perspective. I never looked at stigma and discrimination as distinctly as you described these to be. So thanks a lot for that perspective, Dr. Pathare. Um, So you have worked in very diverse geographies. I want to hear from you how stigma and discrimination is typically different in urban communities and in rural communities, and what are the things that you would watch out for to know this is happening?
I don't think that stigma and discrimination are particularly different in urban or rural communities. I think they tend to be very similar. And also, the language might be a little bit more sophisticated, maybe in urban communities, and it may be a little bit more hidden in urban communities because people have some degree, they kind of tuned to the fact that they don't want to get caught out at it or something. But beyond that, I don't think fundamentally the stigma or discrimination is particularly different in rural communities or urban communities, and even across countries. I don't think that any particular country has a monopoly on stigma and discrimination. This is a universal condition. Uh, and the biggest culprits for stigma and discrimination, or discrimination particularly, I would hold governments across the world as one of the biggest culprits for creating this discrimination because of their policies and their laws. Because what they do, what states, and when I say governments, I actually mean states, meaning countries doing it, and I don't use state in the way that to mean Maharashtra state or anything. I mean states as in countries. Uh, what they do is that they actually legitimize discrimination through their policies and through their laws. And that gives a message to communities that it's okay to discriminate because the state is saying you can discriminate. Let me give you an example from India, for example. We have our Hindu Marriage Act. Had until 1976, there were four medical conditions which were grounds for divorce: leprosy, venereal diseases, there was epilepsy, and there was mental illness. Okay, and in 76 they amended the law and they removed leprosy. They removed epilepsy from it. So what was really left was leprosy and mental illness. And recently, about 2 years ago, the government amended the laws again and removed leprosy from all of the laws. But mental illness continues to be there. You see, now, why would you keep mental illness? If you're happy to remove everything else, why would you keep mental illness in there? Why should mental illness be grounds for divorce? Why should an illness be grounds for divorce? I can understand you saying that if people are not able to perform the duties of marriage, whatever that might mean, and that can be grounds for divorce. That's completely fine. But why would you then identify only mental illness? I mean, many people might be unfit for marriage even if they don't have a mental illness. So this is what creates a problem. Now this gives out a message that somehow it's fine to discriminate because even the government is saying that they are not exactly same and equal as others. And you'll find this across the world in many places. We looked at employment legislation, for example, across the world, and there are discriminatory provisions. We looked at provisions for inheritance, for example, or writing wills, for example. There are discriminatory provisions in those legislations across the world. So what happens is you kind of create a situation where you have institutionalized discrimination. There's structural discrimination, and then societies continue to just carry that forward. So if we really want to make a difference, then we need to strike down these discriminatory provisions in our policies, in our laws, and the way we treat people. A lot of employment legislation, for example, provides no protection if you have a mental health problem, while it might provide protection if you have a physical health problem. Uh, so the notion of parity, insurance is another example. In many countries, including India, until recently the Mental Health Care Act came in place. Uh, Insurers were free to exclude mental illness coverage from health insurance. Now, why would you exclude mental illness coverage if you are going to cover everything else? So the notion of parity is what we really need to be looking at when we are looking at reducing this discrimination and stigma against mental health problems.
That was quite thought provoking, and that also makes me feel there is so much within the system that actually needs to change. And I'm sure each one of us can be a catalyst to that change in some or the other way. Um, since you mentioned mental health in relation to employment, I think I'll take a moment to look at answers in the poll. Can we have the first poll, please? Yes. So here, uh, roughly about 30 people have answered, 31 people have answered, and about 70% agreed that they have had to take a day off from work or college due to low mood. But they have cited some other reason for it, probably something like fever or maybe personal work or something like that. Uh, any quick comment from you on this, Dr. Thare?
Well, I'm not surprised. I think anybody, any sensible person would do the same. The reason for it being that if you are going to identify and say, I have a mental health problem, and if the laws of your country do not provide protection from, say, unfair dismissal, or if it means that your colleagues will treat you differently, or your employers could get rid of you, why would you want to take the risk? So when we keep on saying, oh, people should come out and talk about their mental health problems, or people should seek help for their mental health problems, the problem is the minute you get a label of mental illness, you could lose a whole bunch of your rights. Now, why would anyone willingly want to get a label of a mental illness label on themselves if that means you're losing rights? So, I think people who said that they've done this way, I think are being completely sensible about the whole thing. I mean, I would in fact say that there's nothing wrong with that at all, that people do that. But it also points to the fact that we need systemic changes if we want people to come out and seek help for mental health problems. And you need to create an environment where seeking help for mental health problems does not mean that you run the risk of losing something. And if you run the risk of losing things, and important things, for example, like a job, then clearly you're not going to come out and talk about your mental health problems.
That's so true and also relatable to some extent. Um, so, so we have a very diverse audience here, people from different streams, different backgrounds, etc. Um, so I'm going to ask you a very interesting question now. So in India, we have a large public sector. Okay, so can we ever imagine the public sector to take lead in how mental health is actually prioritized in workplaces and thus set a compelling work standard for the private and for the not-for-profit organization? Is it an imaginable thing? Can we expect the public sector to do that, or is it like a distant dream?
Well, I mean, I would say that everybody should take the lead. Why should the public sector alone have to take the lead? There's nothing to stop the private sector from taking the lead. In fact, the private sector has taken the lead in bringing about many innovations around employment in this country. So why shouldn't they take the lead in bringing about this innovation too? So, for example, work from home. The private sector is at the forefront of asking for changes to how people's employment happens. So why shouldn't the private sector, and why shouldn't the third sector, so as to speak, which is made up of the not-for-profit sector, also not do the same thing? The public sector can do it and should do it. So it's not a question of should the public sector do it or not do it. Of course, they should do it. But my concern has been that many of the practices that we have in the public sector, for example, have never translated into the private sector, because then the private sector says, "Oh, we can't afford to do all of this." So there's a danger that the public sector does it, and that doesn't mean that the private sector follows their lead at all. So my suggestion is that everyone should do it, and increasingly, the number of jobs that are being created are largely being created in the private sector, not in the public sector. So if the jobs are getting created in the private sector, then that is the place where we really need to focus our attention on. So it's not about who takes the lead. There's nothing to stop the private sector from taking the lead. There's also nothing to stop the not-for-profit sector from taking a lead on this. Everybody should be doing this. It's not just for one or the other sector.
Yes, but it's typically perceived that the working conditions or the work workplace standards in public sector are not as well regulated as those in the private sector, which is why a lot of people, so be it doctors or be it people working in any other public sector organizations, they are the ones who generally have to show up at work. They have to be present at work. Staying absent from work is a little more of a hassle in the public sector generally.
Well, look, I mean, we are talking about the public sector and the private sector, but let's not forget the fact that the organized public sector and the organized private sector actually accounts for the smallest, for a very small proportion of the total employment in this country. And there is the large unorganized and informal sector, which actually is where a lot of people will work and where a lot of people who are more likely to be vulnerable will be working. And what are we doing about that? Now, there we haven't really been able to bring about any kind of change at all. And the other thing is that I've heard a lot of there's a lot of interest in workplace mental health, and one of the arguments that has always been made to companies to do it is because it's been put as that it's actually profitable to invest in mental health. Now there's a certain, and I can understand many people have a certain abhorrence to this idea that the only way you can convince employers to invest in mental health is because there is profit at the end of it. And I can very well appreciate why they would feel that way. But we also know that probably in the short run, if you're able to show that there is actually a benefit for employers in the only way that employers understand, which is their bottom line, then they are likely to actually do something. So, for example, there are studies from the US. We don't have studies here, but there are studies from Europe and US, for example, which show that the depression might be accounting for trillions of dollars of lost productivity. There was one study from the UK, I remember, which talked about the loss of almost 1.5% of GDP because of mental health problems. And so, if you look at how much money is being lost because of mental health problems which go untreated versus what you might have to invest in treating those mental health problems, then you have a risk, what is it called, a return on your investment, which is pretty good. The WHO keeps on using this language on a return on your investment, which many in the, especially the user community, does not really like that language. But the WHO has always kind of said, well, a dollar invested in mental health pays back about $4 worth of return for society. And for employers too. So there's also a selfish interest, I would say, employers should have in investing in mental health. And the selfish interest would be that they are likely to get a better workforce. They're likely to get more output out of it. So that should be, if nothing else, you want to be driven by your own enlightened self-interest, if nothing else. I mean, I'm not even asking
More
for you to do it.
productive,
Yes,
more
well,
productive workforce.
and you have something to gain at the end of it, a more productive workforce. Leave aside all of the intangible gains that accrue to companies and societies and communities when people's mental health problems are dealt with. There might also be actual financial gain for organizations when they actually invest in mental health problems. So this is something that should make a compelling argument. So I think we need a combination of both. We need encouragement. You need the carrot and stick. You need encouragement, but at the same time, you also need regulation and legislation, which might act like a stick. So you need a combination of both. You need the carrot and the stick. By itself, neither the stick nor the carrot on its own will actually get movement. But I think you need a combination of both to get employers, either in any sector and even informal employers, to start moving towards investing in mental health, which is an investment in everybody's future.
Okay. I hope the employers in the audience are listening to this as well. So before we go on to the next question for Dr. Pathare, may I request for the second poll question to be published? Yes, Thank you. So, since you mentioned that mental health is eventually linked to more productive workforce or a more productive individual, um, so with mental health now being linked to the economic or rather holistic development of a country, what do you think India can do uh, in the field of mental health to sort of head towards a more holistic development of the nation?
There's a whole bunch of things that we not only could do but should have done before and maybe need to at least do now. um, Let me start with what data we have. There was a study called the National Mental Health Survey, which was carried out by NIMHANS in Bangalore, which is the National Institute of Mental Health and Neurosciences. A very large, well designed, well executed, representative survey across the country with a large sample size, so we can be very certain that the results that they have are reasonably representative of the country.
Accurate, yes.
And what they found was very interesting. They found that there were 150 million people in this country who had a diagnosable mental illness. I'm not talking about people with just mental health problems. I'm talking about people who, if they were to see a clinician, they would be diagnosed with mental illness. So they found about 150 million people had that. And secondly, which is even more worrying, what they found is that close to 80 to 85% of these people actually received no help or treatment. So we had this care gap, this gap between the need versus what we are providing at like 85% even before the pandemic. Probably what the pandemic has done is increase the level of need, and this gap must have now gone up to like a 95%, which means that very small numbers of people are actually getting the help that they need. Now, so we should have been doing it before. We do need to do it now with the pandemic. And I know the immediate question that everyone will ask after this is they'll say, "Oh yeah, but we don't have enough psychiatrists and psychologists to be able to do that." That's the standard reaction. And to that, my answer is quite simple. I would ask people to just move away from mental health for a minute and ask yourself, India had a huge maternal mortality rate. We had a huge infant mortality rate. We had a huge child mortality rate. And over the last 2 decades, we have significantly brought down all of these. The maternal mortality is down, infant mortality has come down significantly. And the way we did it is not because we suddenly produced a lot of obstetricians and pediatricians. We brought down the infant mortality rate not because we had every child who had any kind of problem being seen by a pediatrician, or every pregnant mother being seen by an obstetrician. What we did was we learned how to provide care to people using people who didn't necessarily have to be medical doctors. So the midwives, the Anganwadi workers, these are examples of how we manage to provide that care. And if we want to reach mental health, and if you want to address the mental health problem that we have now in the same way that we managed to address the maternal and child health issues, then we need to go down that route. We need to not say, oh, we can't deal with it because we don't have enough psychiatrists or we don't have enough psychologists. We should be asking ourselves, how can we use our community health workers? How can we use our communities to be able to provide basic mental health care? So we need to try and think of it as a graded approach. Rather than saying everyone, I mean, just use the example. If you woke up with a cough or a cold tomorrow morning, rather, you are not going to say reach for the phone and immediately try and say, okay, let me go and see an intensive care specialist or a pulmonologist. That's not what you do. What you'd probably most likely do is do some home remedies. You'll try to help yourself. That's self-care. Now we should be teaching mental health self-care to all children, for example. We should be teaching mental health self-care to all adults, so that amount of self-care which you do for a cough and a cold can be done by yourself. If that did not work, then what would you do? You'd probably ask around. You'll speak to someone in your family. You might speak to a neighbor or a friend and say, we're having this cough or cold, and they'll tell you some home remedies to do, or they'll tell you to do XYZ. And that's what would be called informal care. Now you can have informal care for mental health. You can train people to be informal counselors to provide mental health care when required. And if that doesn't work, you might say, well, it's not working, I'll go and see my GP, it's not getting better. And the GP might say, oh, well, come and see me after 4 days, take these pills, and let's see how you're doing. And that the equivalent of that would be that you have community health workers, you have general practitioners who can deal with mental health problems. And only if that does not work is when your GP, like you go back to the GP and say, I'm still coughing and my fever is still bad and something is not right, then your GP says, well, maybe we should get some X-ray done and I'll book you to see a specialist because I think maybe it's time now to see a specialist. And that would be the equivalent when you want to say, okay, maybe this is the time for you to now see a psychologist or a psychiatrist. And if we do it that way, then we will actually use our resources, which are in short supply, for the most appropriate people who need it rather than everybody. If everybody turned up with a psychologist or a psychiatrist for every minor problem, you'll just crowd out the whole space, and people who really need their help are not going to get it. The ones who really need to be seeing a psychiatrist will not get seen. So I think we need a national strategy to plan this out and see how we are doing it. Currently, what happens is that it's a hit and miss affair. Really, whether you get to see someone or not is driven by two things, Joe. One is geography, and the second is money. And what I mean by geography is that depends where you live. If you live in an urban city, large urban conglomeration, you might end up seeing a psychologist or a psychiatrist straight away. If you live in a rural place, you'll probably see nobody. And if you have the finances, you'll probably end up booking an appointment with a therapist. If you don't have the finances, you do absolutely nothing. So that this kind of lottery, the geography and money lottery, needs to really stop, so that we have properly planned services where people who need you need to provide care based on people's need rather than on what they can afford or where they live.
You exude so much optimism, and what you just described sounds like first aid for mental health, if I may call it that. So having broadly understood what is it that the nation or communities can do, I am now more interested in knowing, beyond self-care and beyond sort of building that resilience, what is it that I can do as an individual to not be a part of stigma or discrimination, and how can I be a part of solution for that?
I think Eleanor Roosevelt long ago said something with respect to rights, which said, where do human rights begin? And she said they begin in small places close to home. And I would paraphrase Eleanor Roosevelt on this one and say, all these changes, these small changes, begin at home. In fact, begin with ourselves, and they begin with our language. I think how we use language also matters. How we treat and identify people matters. And what do I mean by language? What happens is, if you have a mental health problem, or if you've been diagnosed as having a mental illness, then very quickly that becomes your identity. No other identity. You have no other identity. You might be a medical doctor, you might be a mother, you might be a brother, you might be a sister, you might be an employee, you might be anything else, you might be an activist, for example. And you will suddenly find that all those identities get erased, and the only identity that everyone recognizes you by is your identity of being a mentally ill person. And our language in public discourse, and I've always opposed this notion of a mentally ill person. There is no mentally ill person. What you have is persons living with mental illness. And so the language is important, because if you need to retain people's identities. Referring to people as diabetics or as hypertensives reduces people's entire existence to their illness. And that is something that we really need to change. And why is language important? Because it's very subtle. You don't even realize what you've done. And it kind of then becomes very pernicious. And people stop seeing them as human beings. You stop seeing Radha as Radha. You start seeing Radha as a mentally ill person. That's all. And then you start drawing conclusions, and you change your behavior accordingly, rather than seeing Radha as a person who has who's a person in her own right and may have had depression sometime in the past. So I think language is probably something that we all can do. Doesn't require anything particularly that we need to learn. And the second thing that we need to do is ask ourselves, how do we behave when we see somebody who has a mental health problem? How do we behave? Do we treat them like everybody else, or we don't treat them like everybody else? You don't have to answer this publicly in many ways, but ask yourself, when in private spaces, in those small spaces, as I say, how do you treat people who have a mental health problem? And that, I think, is the crux to bringing about change. Change is going to happen if we bring about change in those small places.
Dr. Pataria, I think this is a perfect moment for us to look at answers to our second poll question. You know, so we have about 28 votes, and majority feel that persons with mental illness can lead normal lives. Now, after what you just described, I would sort of want to rephrase this as person with lived experience of mental illness, right? So if I have had depression in the past, I'm not a depressed person. I'm a person with a lived experience of depression because I'm so much more than just that.
Yeah,
And that's such a paradigm shift. Thank you so much. So yes, we now enter a very interesting segment of this fireside chat. So I would request for the third poll question to be sort of put in the poll section here on Meet. Dr. Pathari, we now move towards rapid fire. So it's quick questions and quick answers. Are you ready?
sure. Yeah, go ahead. Shoot.
Okay. Okay, here we go. So if hope is the most powerful word for people with lived experience of mental health, what is the second most powerful word?
Inclusion.
Wow. Okay, wow. One thing that each one in the audience can do to reduce stigma around mental health. You just answered it, but one key thing that I would want to practice from today.
Well, I stop the social exclusion, which happens in everyday life. Every minute of our living day, stop social exclusion.
Okay. One unbeatable strength that India must capitalize on to deal with the pandemic of mental illness that we have today.
Well, I think the biggest strength is our young people, and we really have to capitalize on that. We need to work with the young, and that's where change will happen.
An undeniable right to mental health that all of us have is that of
Being included and participating in society, being able to live a full and equal life in society.
I think the word inclusion is worth 1,000 words in itself, right?
Yes, yes. I'm just trying to tell you different ways in which inclusion happens or should happen.
Yes, 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 I'm realizing that. One mindful habit that you follow.
Oh, I don't get too upset with criticism. It's a little bit like water off a duck's back. People are entitled to their opinions. I'm entitled to ignore it.
Okay, interesting. Your favorite mental health book.
It's a book which keeps on going out of print, and I wish it would not do so. It's a book written by Professor Richard Warner, who was a psychiatrist in the U.S. in Boulder, Texas. It's called "Recovery from Schizophrenia: Mental Illness and the Political Economy," and I think it's a very interesting book, and everyone should read it.
Okay, I'm sure many are looking it up already, looking it up online. Guys, wait till the session ends. As a policymaker, you wish this for mental health. As a policymaker.
That we just implement the National Mental Health Policy and the Mental Health Care Act in its letter and spirit.
A hobby that gives you great joy.
Oh, it's a hobby. It gives me great joy, but I don't have time for it these days, and that's cheese making.
Oh,
I keep on. Well, you can ask all my friends in Goa, for example.
oh,
One of the
interesting.
one of the dream is to retire to Goa and start a cheese making start artisanal cheese making.
Wow. Wow. That's really, really interesting. Uh, okay, so we have now come towards the end of the session. But before we close, I think we have time to take maybe one or two questions from the audience. Um, okay. Okay, so this one says the talk about mental health is often curative, very rarely preventive. Can policy changes in our education system take into account emotional hygiene and make us better equipped to take care of our mind, or is it too far fetched? So, do you feel the education system as such has a role to play into this? Maybe have it in the curriculum or any other way that you think?
Absolutely. I said this earlier too. I said about self care and I said about training and teaching young people how to look after their own mental health. And I think that has to happen through the education system. Not only does it have to happen through the education system, we need to also look at our entire education system and ask ourselves, is it actually conducive for mental health? Are we, we've got a book coming out, Abhijit, Amrita, and I are just having a book coming out very soon looking
Wow.
at suicide prevention, where we make the case that what we find is that if we want to prevent, for example, suicides in young people, and India is the largest number of young people dying of suicide. It's the number one cause of death. If you're a young person in this country, a young woman especially in this country, it is the number one cause of death ahead of maternal mortality. uh, the only way we are going to be able to do that is actually if we revamp and turn our education system upside down too, because that is also largely one of the drivers of why young people are killing themselves. So I think we have to not only use the education system to use the scope to teach people how to look after themselves, but also look at the education system and say how does it need to change so that it is more conducive to good mental health.
Okay, okay. While I go to the next question, can I have answers of the third poll featured on the stage, please? Yeah, so this is what are some of the common reasons why people don't seek help for mental illness? Uh, a quick comment on this, Dr. Patare. Since the entire session is revolving around stigma and discrimination, we looked at some of the top causes why people don't actually seek help for mental health issues. So I'm sure whoever has attended this session is definitely taking home something which they can implement by themselves and make at least one person who is living the experience of a mental illness want to seek help.
Well,
Any
like,
quick comment from you on
yeah,
this?
so the quick comment on this is for people to go home with the three, what is called as the triple AQ. The triple AQ is very simple. The first A is availability. So mental health services need to be available. If they're not available, you can't actually seek help. They need to be accessible. And accessible can mean geographically, financially accessible. They need to be acceptable, which means they're provided in a way that is acceptable to people. If you tell people the only way you're going to get a mental health service is for you to turn up at the mental hospital, you're not going to actually get people turning up at a mental hospital. And the fourth is quality. We need to ensure that those mental health services are of good quality. Why would people access poor quality services? So if you want to improve people's help seeking behavior, we also need to address from the supply side, you need to address the triple AQ, which is availability, accessibility, acceptability, and quality.
Yes, thank you so much. We have now come to the end of this session. Uh, what a discussion, or shall I say, what a charcha. Mental health as a topic is actually very wide, and it is cross-cutting with several other social issues. This fireside chat majorly aimed at reflecting on the stigma and the discrimination around mental illness in general. We looked at several things, starting from what the COVID-19 pandemic has done to how stigma and discrimination itself are two distinct things that need to be looked at through different approaches. We also looked at what is it that workplaces can do. And Dr. Pathari beautifully highlighted the importance of inclusion and inclusivity in the context of mental health. We also looked at what the nation can do and what each one of us can do as individuals to be a part of a solution to a problem which can very well be addressed through change in attitude, change in behavior, and by motivating people around us to actually seek help when they need to. So I hope each one in the audience is actually able to initiate a charcha at their own level. So while in the session I say let's end, I would still say let's talk. So thank you so much, Dr. Pathare, for giving us your time, for being here at this moment and adding value to this discussion. Thank you so much.
Thank you, Radha. Thanks to you and to the organizers for inviting me and giving me this opportunity.
It's a pleasure and honor.
Thank you, Dr. Pathare. Thank you, Radha, for the wonderful session. We all loved it, enjoyed it. Can't say more. A nice way to end our health tech session of first day. Look forward to have you all again tomorrow at morning around 10 o'clock. Till then, good night. Bye.
Thank you. Thank you, everyone. Bye-bye.